Okay, welcome. I'm Dr. Nick Wilson,
I'm Dr. Traci Gross.
and we are talking about 5 steps to a balanced nervous system. Nervous system is important.
Nervous system is so important. Everyone has a nervous system, and it controls literally everything that happens in your body. Your nervous system is made of your brain and your spinal cord and all the nerves that go out to every single part of your body.
So we know that brain and spinal cord is very important, yes. But when we have an improperly balanced nervous system or imbalanced nervous system, that's what leads to chronic sickness and disease. We know that. And so there's 2 parts of your nervous system. This is so important for you to get because this is the missing link in healthcare, I believe. We have endocrinologists, we have gastroenterologists, we have doctors, pulmonologists, cardiologists. You can name all the different specialists, and yet who's responsible for the health, not just the pathology of your spine and nervous system? And the problem is that most people are walking around not knowing how critically important it is or how to manage it and make sure that they're maintaining good, proper nervous system hygiene over time. And so we're going to be talking about that. We're going through the 5 steps for a properly balanced nervous system, but there's 2 parts. And I think this is important for everyone to understand. There's your sympathetic nervous system and your parasympathetic nervous system. So sympathetic is what? Fight or flight, right? What's the common analogy if you see a what in the woods?
A bear in the woods.
A bear in the woods. Your fight or flight nervous system kicks in to get you out of there quickly. You don't need to digest food when you see a bear in the woods. You need to get blood to your extremities to get you out of there very, very quickly. So that's a stress response. But there's a lot of people walking around in fight or flight in their nervous system, but they're not looking at a bear in the woods. Why are they in fight or flight?
So they get stuck there because of constant stress. Day-to-day life is very stressful. So sometimes our bodies, because of our thoughts, get stuck in that stress mode. Now that's detrimental to our health, not just mentally. It has a toll on our mental health, but it's also detrimental physically because when we're stuck in that constant stress, our bodies aren't able to switch into parasympathetic, which is exactly where we need to be in order to heal and to rejuvenate, for cells to turn over and our bodies to express health.
And parasympathetic mode is when your body's in rest, digest, rebuild, rejuvenate, and repair, right? And so that's the mode that we really want to be in the vast majority of our time. We need both. We need that stress response in life, yet we don't need to be stuck there. And that leads us to number 1. We're talking about the 5 steps right now to a balanced nervous system. Number 1 is your mindset. And we all know that you can think yourself sick. We've been there before. You might have been there before. Ever have like a test that came up and a deadline, and then you got over it, and then on the back end, all of a sudden, it's like this letdown effect, and then you ended up getting sick. Or I remember getting sick after my last examination in school, and then I got really, really sick afterwards, is because I had stayed up over long periods of time, and I was stressing out about this one exam, and then boom, get sick. There's a lot of people like that who are grieving, or maybe they have stress or deadlines at work, and then they end up having a low immune system, they get sick. How in the heck does that happen where your brain or your thoughts actually control your physiology? How does that happen?
So your thoughts are so powerful. In the same way that you can think yourself sick, you can also put healing thoughts in your brain and think yourself toward healing. That is a huge component of having a healthy and whole body.
Well, think about this. How do placebos work? So placebo is just a sugar pill. They give you a placebo, and all of a sudden they know that placebos are actually fairly powerful. There's been plenty of studies that showed that giving a placebo is equal or greater to the actual drug itself. What happened there? The person believed themselves to be taking something that was good for their health, and so their health actually came in alignment with that. It's all because of how powerful the brain is. It's mind over medicine. So mindset is number 1. Number 2 is nutrients. And we talk about nutrients. There are nutrients that you can take in that will actually increase inflammation in the body and also destroy your nervous system. And so one of those nutrients is sugar. So sugar is actually inflammatory. And people will say to me all the time, they'll say things like, well, doc, I don't eat sugar. Well, we're not just talking about candy. We're not just talking about, we're not talking about like the sources that are usually thought of when you think about sugar. There's a lot of hidden sources when it comes to sugar.
Oh yeah, you can go to the grocery store, and if you turn to look at the nutrition label on anything in the middle aisles, it's going to be loaded with sugar, hidden sugars that you might not even know about.
And people who don't eat it, they're probably drinking it. right?
Oh yeah.
Soda and or pop, whichever part of the country you're from. And then when it comes to, you know, your Frappuccinos and your, you know, your big gulps and your Gatorades and whatever it is, you're getting sugar from so many different sources. And the challenge is that most people think of themselves to be healthy and not eat poorly. Well, I bet if you looked at what you're getting in as far as food goes, I bet you're getting a lot of sugar, because the average American consumes 168 pounds of sugar every single year. So think about that. Inflammatory. And then we're minimizing fat, because we make fat the enemy. We say, well, fat makes you fat, so we don't get in good, healthy fat. You've been lied to if you've been told that, because fat is actually critically important for your nervous system. Brain made up of fat. Hormones are, you know, hormones need fat. We need fat. And so our nervous system is coated with fat, and yet we minimize our fat because we believe that fat is bad for us. But it's got to be good fat.
Yes.
Yeah. So what are some of the like good fats that we should be consuming?
So good healthy fats, examples of those would be like coconut oil is a good healthy fat. Avocados, those are great for you. Also very trendy right now, eat avocados. Those kinds of fats are things that you need to be incorporating into your diet on a daily basis.
Yeah. So we talked about mindset, nutrients. And now what about toxins? Because we know toxins, because we say get in good healthy nutrients, but unfortunately our food many times is either manipulated or sprayed with toxins that we know this, the pesticides and the glyphosate and others that are extremely toxic to the human body. But it's not just from glyphosate. What are some of the other toxins that we're exposing ourselves to that is neurotoxic and wrecking our nervous system?
Oh yeah, toxins are everywhere. Sometimes it's kind of hard to think about avoiding toxins altogether, but the idea is minimizing, decreasing the amount of exposure. It's unrealistic to think that we can get rid of all toxins in our lives because they are in the chemical products that we use for cleaning. They're in plastic, so like Tupperware, even the personal care products that we use, especially the personal care products we use, deodorant for women, cosmetics, the makeup, lotions we put on our skin. All of those things are very loaded with toxins, especially if they have fragrances attached to them. So the idea is to take a look and really examine the products that you're using on a day-to-day basis and look at those ingredients. There are a couple of resources that you can use to look up the toxicity level of some of those ingredients, and then look for products that don't have those ingredients or minimize them.
Yeah, so ewg.org is a great resource for you. Hey, listen, right now, you should be taking notes. I hope you are taking notes. If you're driving right now, make sure, listen, come back to this, and you want to make sure, maybe even pull over. We're not going very much longer here, so make sure you're glued to this. Make sure you're, because this information can save your life. We're not just talking about toxins that, will actually cause me to, may not live to be 120, but who cares? That's not what we're talking about right now. Listen, we're talking about chronic disease. We're talking about the average American right now who's sick and suffering. 5 out of 6 Americans are dying of heart disease and cancer. We know diabetes is on the rise. There's been a 200% increase in dementia-like disorders and Alzheimer's in young people that aged between 30 and 64, a 200% increase. And we know this is, they say it's environmental. Well, what does that mean? That's not pollution. That's what we're doing to ourselves. It's actually contributing to these things. It's what we're the body that we are creating. This is the environment that we're creating within ourselves. And so understanding how critically important this is, yes, your mind is important. Yes, the nutrients, yes, the toxins, and yes, the movement. And that brings us to number 4 is movement. How critically important is movement to your spine and nervous system?
Movement to your spine and nervous system is life. It's the nutrients. It's actually how your body is able to pump nutrients throughout your spine up to your brain and recycle, get rid of the waste and bring nutrients to your brain. So it's critical for your nervous system. 90%
of the nutrients to the brain are stimulated by movements of your spine. So think about that. So the problem is that a lot of people aren't moving. And, during that whole COVID-19 pandemic, people gained the COVID-19 because of being at home. And so, but the reality is that, people say, well, I couldn't go to the gyms because the gyms were shut down. Well, the reality is they probably weren't going in general. And so what type of movements, a lot of people, right?
Yes,
a lot of people,
yes.
But what type of movements we need to be doing? Well, the key is to actually move, get up, sweat daily, breathe hard daily. There's a lot of people who never actually inflate and deflate their lungs on a day-to-day basis. So a lot of times at our seminars, we'll have people do that because it's so critically important. And again, movement of your spine is critical for the nutrition of your brain. So get up, move on a daily basis, sweat on a regular basis. So important. The last one, I believe, most important. If you hear nothing else, listen, if you hear nothing else that we say during this, hear this. The last one, when we talk about the importance and the things that you can do to help with a balanced nervous system, is number 5. And that is what?
Alignment.
Alignment of your spine specifically. Now talk to me about, because this is personal for you. It really is for me too, but your story, this is personal for you. So talk to me a little bit about that.
Yeah. So I never knew the importance of alignment in the spine. I didn't even really know about chiropractic and what was involved in that, or the nervous system, until I experienced firsthand the power that the nervous system has on the healing of the entire body. So my whole life growing up, I struggled with chronic digestive issues. I had countless medications. I can't even think about how many medications I used to take, but I would see doctors and specialists my whole life. I had colonoscopies and endoscopies, and I never got any answers. I was always told that this was just the way my body worked, or different than other people's, and I would have to get used to that. So that's how I lived. I was 21 years old, and I was in a car accident, and I had a whiplash injury. So because of that whiplash injury, I went to a chiropractor. And yes, it helped with the whiplash injury. It was great. But it was also the first time in my life that I started to see improvement in my digestion. And the reason for that is because I didn't know that I had misalignment in the middle of my back. And that's exactly where the nerves go from my spine to the stomach, to the intestines. And by getting that misalignment adjusted, by realigning the spine, that was how my brain was able to speak to those areas of my body and tell them how to heal and function properly.
Well, because the spine, it makes total sense. If you actually look at the anatomy, like if you want to look at this, the spine should be straight up and down this, and it should have these 3 distinct curves from the side. So one in the neck, one in the mid back, and one in the low back. So either the spine is important or it's not. Either it is or it isn't, because if you actually look at this, there's 24 individual movable vertebrae. And if you think about how important the nervous system is, this is the only system that's entirely surrounded and protected by hard bone. And so from the brainstem all the way down to the bottom, these have to be in good alignment. But what happens because of car accidents, a Yale study showed that 8.2 miles per hour or greater changes the spine. Because of whiplash, because of sports injuries, because of poor posture, because of the traumas, the slips and falls, the sports repetitive stresses that we do with sports, one-sided activities, texting, technology. Right now, sitting is to the spine like sugar is to your teeth. So right now, if you're sitting, sit up nice and tall right now, because sitting is to your spine like sugar is to your teeth. So poor posture. And so we really need to be on these big bones, our femur bones and our leg bones, and not these. Look how little these bones are. And we're on these day in and day out, sometimes for hours at a time. And our spine is slowly moving, slowly changing, and it really doesn't take much over time for it to do this. Boom. And then that right there, that's what's called subluxation. And you can see what's happening to that nerve right there. And when you have what's called subluxation, wherever that nerve goes is going to be affected. So if that nerve goes into your shoulders or arms or hands or into your wrist or your fingers, might you end up getting shoulder pain, arm pain? Might you end up getting carpal tunnel over time? Might you end up getting numbness into your fingers? Maybe. And why do I say maybe?
Because only 4% of your nerves actually feel pain. The rest of them are function nerves. They go to all of your organs and tell them how to do their jobs.
So can you have all these problems and not actually feel that? The answer to that is absolutely yes. And so, you don't want to judge your health by how you feel. We talk about this a lot in our clinic, is that by the time you actually feel something, you're down the road a bit when it comes to your function. You think about a heart attack. 70% of the time, the very first symptom of heart disease is the heart attack. So think about that. Think about cancer. You don't actually feel cancer as it's developing. You have to lose function before you then start to feel it. And so the key is not to wait until you get the symptoms and to do something about it. It's to have more of a proactive approach when it comes to your health. Now, symptoms are warning signs. Now, talk to me about that. What does it mean to have warning signs or symptoms?
So symptoms are simply created by your body as a warning sign, like you said, to tell you that there's a problem. A good example is things like migraine headaches. When you have a migraine, you typically avoid 2 things. What are the 2 things people avoid? Light and
sound.
Yep, exactly. Light and sound. So the nerves up at the top of the neck here, These ones control blood flow and oxygen to the brain. So people with migraines will typically have an issue up here. These nerves also control your eyes and ears. So there's a connection there. It makes sense that your body uses symptoms to tell you that you need to take action, that there's a problem that you need to fix.
Yeah, 9 times out of 10, when somebody comes in with chronic headaches, you check the top bone of the neck. It's usually the top 2 bones of the neck, the atlas, occiput, even the C2, the axis. And 9 times out of 10, that's the problem. But again, what are we taught to do with our headaches? Think about this. We're taught to drug that, Excedrin or whatever it is. Here's the critical question that you have to ask yourself. Was the cause of your headache a lack of Excedrin in your blood system? Was the cause of your lower back pain the fact that God forgot to equip you with steroid injections? Was the cause of the indigestion the fact that, we just lack Tums in our blood supply? This is not the cause of our problems, yet we continue to mask our symptoms, chase our tail, and we wonder why the average person now takes 12 medications. Every single year, fills 12 medications. That's double what it was just 15 years ago. We wonder where these things are coming from. And so the reality is that these are just like the check engine light that goes off in your car. These symptoms are. Check engine light that goes off in your car tells you to check the engine. There's something wrong in the engine, but how many of us take a piece of duct tape, covered up the check engine light, and keep driving for another 10,000 miles? We don't do that in our cars, do we?
No.
Some people do, but we do that in our bodies. If we treated our cars that way, we know what would happen. But we do that for our bodies, and then we get surprised when we get a symptom. We get surprised when we're on multiple medications. I get patients all the time who will say things like, that doctor, that medical doctor, he just wants to put me on more drugs. Well, hey, we're going into a place where there's specialists with drugs and surgery. And thank God for that. In a crisis situation will absolutely save your life. You cannot get mad at them when they want to put you on drugs and use the tools that they have. You walked in there asking for their help, and they're just trying to help using the tools that they have. Perhaps you're in the wrong system. But we have to understand that these warning signs are just that, they're warning signs. And so somebody comes in with, neck pain as an example. Neck pain, you look at this, many times neck pain is the fact that there's been one or more of these bones in the cervical spine here has shifted out of its normal place. We're seeing that more frequently now because of technology and iPads and even in younger kids now. It's incredible. Yeah. And kids who get their spine checked, it's not because they're running around in pain. Some of them are, though. Some of them are. And what happens is one or more of these bones shifts out of their normal position. It creates what's called a fixation. And that's, again, it's subluxation, and it doesn't move correctly. And so then they, whether they're kids or adults, and they can't move their neck, their range of motion is limited from one direction to the other direction. That's another warning sign. You look at posture. Posture is another warning sign. You look poor posture. Have you ever gone to the airport and just people watched?
Oh, yeah.
Yeah. So I do that. I love doing that. And you just look around and just everyone's on their phone, or they're, rounded out through there. And just there's more and more problems with that. With industrialization, with technology, has created unfortunately, a lot of problems. And especially when it comes to athletes. So we see this with athletes a lot of times. You see them have like shoulder pain, and they have their shoulder treated, and it's not actually their shoulder, it's actually come from the spine. That's because there's the same nerves, and those are, by the way, the same nerves that go into chest cavity, heart, and lungs. It's the same one that goes down into your arms. That's why a common symptom of a heart attack is pain or numbness that goes down to the arm, because that's the same nerves. Most people don't know that.
Yeah.
And so, here's the thing. If you have, you don't want to wait for the warning signs. You don't want to wait for the wheels to fall off the bus to take your health in control of your health and responsibility for your health. But if you have any of the warning signs, or if you've not had your spine and nervous system checked in the last 3 months, well, it's time to get it checked. And there's 2 critical tests that I recommend. One is a surface EMG. Talk to us a little bit about a surface EMG. What is that?
Surface EMG, it reads the electricity in your spine. It's sort of like an EKG for your heart, but it's for your spine. And it tells us if there's any interference in that nervous system. It tells us how subluxations are affecting your nerves. It's actually the only test that we're aware of that can detect dysfunction before it turns into disease in the body. So it's a key preventative test.
Yeah. And number 2 is structural x-rays. Now, there's a caveat to this. You and I have all had x-rays, and people have had x-rays in the past. But there's a little bit of a caveat to this. We're not looking for fractures, bone, and breaks and tumors. we're taking this because we want to see the alignment down to the millimeter. So we measure this very specifically down to the millimeter to see exactly where the spine is shifted, where the nerves are being damaged, ultimately what the effect is on the body, where the organ systems are going to be affected, and then also take follow-up to make sure that there's movement and changes based off of what we predicted. And that's really the missing link, is there's a lot of people, there's a lot of people who've had x-rays done, but is it moving and changing the way that it was anticipated? Because if your spine looks like this, that's a problem. We all understand that. We don't want to leave it there. And just knowing that that exists, is not really what helps you to be healthy. It's really a plan of attack to correct that, to make sure that your body functions and heals at its best over time. And that's really kind of where you got introduced to a lot of this. You knew your problems, you had suffered with your issues, but then he helped you with a plan of attack to correct your problem.
Exactly. Yeah. When you get the information, it's not the information that empowers you. It's doing something about it that really makes change and really helps you achieve better health.
Yeah. And so, here's the thing. If you have any of those warning signs that we mentioned, whether it's, headaches, chronic headaches, I have people who tell me they get the normal headaches. There's no such thing as normal headaches. That is the body's warning sign. If you have neck pain, maybe it's shoulder pain, maybe you've been suffering or struggling with lower back pain or sciatica, or you're struggling with knee pain or hip pain. Listen, there are underlying problems that exist there, and there's causes to that. And not only does that cause the pain, but really, remember, dysfunction turns into full-blown disease. So we want to catch it at dysfunction. We want to correct the underlying problems there first. And so, listen, if you have any of those problems and you want help, you're local to Indianapolis, all you have to do is let us know that you'd like help, and we're going to be able to help you. If you're watching this video, there is going to be a discount for that if you're watching this video. And so if you just follow the instructions along with this video, and we're going to be able to, help you out. The first visit, we go through all the testing. The second visit, we go through what we had found there. And if we can help you, we'll let you know that. And if we can't, we're going to be straightforward with you and let you know that too. And then the third visit's the most important, because that's where we go through, here's how to take full control over your health. Here's how to fully educate yourself on to take ownership and responsibility for your future. And that's my favorite part, because that's where really the lights come on for a lot of people, and they truly understand this for themselves and know how to take care of themselves for the rest of their life.
Yes.
So, hey, hope this was helpful. Listen, if you know someone who needed this information, make sure you share this. Share this message. Who's in your life right now that's maybe not healthy, or maybe needs to know this information, and maybe that person is struggling with their health. Maybe that person just needs a little bit of encouragement. Share this message with them. Share this video, and hey, let's help to change the culture right now.
Yes, I love it.
All right. Hey, Dr. Nick Wilson.
Dr. Traci Gross.
Yep. We'll see you next time.